Usually you want to know family. Are you married? Do you have children? Who do you live with? And what's your work? And why do you care about occupation?
Is there occupational hazards?
Right. Risk factors. Sure, income as well. Yeah, that's another factor for sure. So I know that you are oriented to time, place, and person. Now I could ask you if I were doing a mini mental, do you know the room number? So she's already lost a point, right? The mini mental.
239.
It's 243.
Oh.
Yeah, it's 139 is downstairs.
Oh, that's what I'm picking up.
So there is this neurological assessment that I'm following deliberately. So I have watched her gait as she walked in, how she was able to help with the bed. She appears to have no motor limitations at all. So what is, if I dive right into the cranial nerves, the first one?
Olfactory.
Can you close your eyes?
Yeah, sure.
You think it's recognizable? Okay, so I'm going to give you something to smell and see if you can recognize it.
Cinnamon?
So it is spicy, it's a mint.
Oh, okay.
You know, sometimes we just whip out an alcohol wipe and everyone can identify that. So cranial nerve number 1, that was easy. What's 2?
Op. It's op something.
Optic.
Oh, yeah.
Optic.
Mixing up those old.
So what is that? Can you turn around? And it's that. So can she see? Visual acuity. What is the lowest line you can see?
11. PEZOLCSTD.
Great job.
Yeah. And another part of it is the ophthalmologic examination. So number 3, because that's really outside our domain. I know I haven't taken people into the closet, but maybe we'll have time today to do that and try to visualize retinas. Sometimes we can get a good look at a retina. Just so, one thing, even though we don't do all of these things, if we're with a physician or a mid-level practitioner while they're doing a physical exam and they leave and the patient says, why did he do that? We know why. We should be able to answer what's going on in a physical assessment. So part of it is to look at the retina behind the eye, which is shining the light and getting the red reflex and following it all the way in, but it has to be in the dark. Why? What do your pupils do in bright lights? Constrict. So we're trying to look beyond into the retina, which is behind the eye. So we need dark, and usually if you ever go to the eye doctor, what does the eye doctor do before he looks in at the retina? Drops to dilate the pupil. So we can try. Sometimes some people's retinas are very visible. So cranial nerve number 3 is what? Ocular motor. So is that sensory, motor, or both?
Motor.
It is motor.
Sometime there.
And what do I want to do? Perla. Perla. You got to know it. So please look straight ahead. And you come from the side. So I shine it once, I look at this eye. Then I'm going to shine it again, and I look at the other eye. There's a little bit of consensual constriction. So this eye constricted a fair amount. This one constricted slightly. It just reacts with the other one. And so, again, okay. Now, if you will, follow my finger with your eyes without moving your head. What two things happen?
They should converge and constrict upon, like, when you're the closest.
So the closer an object is, the pupils will constrict. The further away, they'll dilate to kind of be able to see better, right? So that's perla. And when do we use that besides just in an annual exam? A neuro check, right? Someone's had a brain injury. We want to monitor that because that could be an early sign of increased intracranial pressure and affecting the cranial nerves. And that's an easy one to sort of assess without the accommodation, because often people, you're going to do hourly checks and doing it while people are asleep. So we're not going to have them do this, just the pearl part of it. So now I want to do 3, 4, and 6. Yes. The extraocular eye movements. Okay, so it's all the directions. Basically, range of motion of the eyes is what we're looking at. And we can just say they did not move symmetrically. We're not going to diagnose, oh, that's a problem with cranial nerve 4. We just know 3, 4, and 6, extraocular eye movements. And again, we have to explain to the patient, they may not know what to do. Can you follow my finger with your eyes without moving your head? Full range of motion. So 3, 4, and 6. Now we have 5. What? The 3, right? Trigeminal. The 3 branches. And what is the function?
Both.
Both. Yeah. So let me ask you, how do you know that?
Some say
Oh,
marry
so
money.
you use that one. You didn't write
But-
your own, huh?
I have, but big brains matter more. Or big butts or boobs.
Whatever helps you to remember.
Yeah, whatever works. So some say marry money. My brother says bad business, marry money.
My
There's-
brother says big brains matter more.
Baked.
Big brains matter more.
Oh, big brains matter more. So trigeminal, 3 branches. Sensory and motor. So 4, 5. I am not going to put anything in her eye, right? So cornea sensation. But
Would you if this wasn't, if we weren't at school?
if
Like if there wasn't
Oh,
an insurance
no,
liability?
I think only if there's a problem, like
Okay.
someone comes in and there's a scratch on the eye and they didn't even feel it. So you would wonder, gee, I mean, because our eyes are really sensitive to dust coming in the eye, and someone should be aware.
Okay.
So that could be cranial nerve 5 for the cornea, but generally not. Although when you go for an annual exam, they do test your glaucoma, so you can sort of feel that. But so can you? You can do 5 and 7 together for motor. Just full range of motion of the face. Blow out your cheeks. Raise your eyebrows. Move your jaw side to side. All right. So full range of motion. Now, so there's branches there, there, and there. With your eyes closed, soft, sharp. So soft would be the cotton tip, and sharp would be the broken stick. So where and what am I touching you with?
Soft and warm.
Which side?
Forehead. Sharp. At the bottom. Chin near my cheek.
What side?
Soft on my right cheek. Sharp on the top of my left forehead.
So I would say sensory and motor function are intact. So we're already up to 7. So I am going to put the tuning fork on the top of the front of your skull and tell me if you hear or feel it. Some people describe it as feeling it. Where?
Whoa.
It's more of a feeling on both sides.
Right. So that's, really the bone conduction, the sound. And that was a normal finding. So I want you to tell me when you no longer feel it. Do you hear it?
So is that one Rinna or Weber?
Weber, Rinna.
Okay, Rinna rings. Okay.
Okay.
I need stuff like that.
And 8 is also balance. So we'll do that when she's walking. Okay, 8. 9 and 10. So 9 and 10 are speech, glossopharyngeal in the vagus, motor and sensory, swallowing, and speech. So we do the neck and we always want someone to swallow. Can you swallow? So swallowing and her speech, I've already been speaking with her. So taste, well, I'm not gonna do taste. Do you enjoy eating?
Yes, of course.
That was easy. So that's about it. Oh, okay, this. This is not a very good description. I never handed this out, I don't think, but I'm not really happy with it. So the uvula. So you can integrate the exam like with the throat. So can you open your mouth? Say ah, ah, ah. Midline. So palate rose. It's garbage. And then 11 and 12. So also stick out your tongue. Side to side. I could also use the tongue depressor to assess the strength. And now I'm going to apply resistance to your head and shoulders, and you just push back.
Okay.
Push, 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 push. And then I can continue with the muscles, right? Push against me, push against me, push, push, squeeze my fingers, harder. Yeah, okay. Why is that important? I'm going to see if I can get her up out of bed and what kind of strength she's going to have, right? And what if she starts to fall, or how's she going to get up out of bed if she has no grip? Even, she's going to need help. So these are important. Oh, can you toss off your shoes? Push, push. Oh, what's your glasses? Push, 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 push. And why is that important? Push harder. If she stands up, she's got to support herself. So we want strength. Reflexes.
What is that called?
What?
What is that called? The
What's
tool
what?
for reflexes.
The hammer?
Oh, okay.
It's called a reflex hammer. Okay. So we always want to feel like we're going to be successful. So what's a good one to start with?
The knee.
Yeah, right? So you're relaxed? So you want to go below the kneecap a little bit. Oh, there you go. You helping me?
Yes. No, I'm looking.
Achilles. This can be hard. Are you relaxed?
Yeah.
No, you're not
Oh,
relaxed.
thank you.
I know. I don't think I've shown you the other way to do this. So you're not relaxed. We'll have to do the other way. I need a chair. Actually, this is probably a good place to do it. Can you kneel?
Kneel on this.
Mm-hmm.
Okay.
So this is a good way to make sure that the Achilles tendon is released. And you want to go above the heel. I can feel it. Maybe just spread them a little bit apart if that's okay. All right. Did you see it? Put the pedal to the metal. Or the metal to the pedal. I don't know. Very good. It
That was
made a
cute.
big difference because it has to be released when she's in that position. Can you go back to bed? Oh, can you get up?
I don't think so.
Lower it.
This is a high level. Just restrict.
Okay, what's next? Do you know the names? So it's biceps, triceps, brachioradialis. So at right angles, sometimes the pillow can help. And palm facing down at a right angle. Can you roll your sleeve up?
Yep.
Okay. So we want to find the tendon for the bicep right there. Did you feel it or not?
No.
Nope. Mhm. There it is. So let's see how we do here. No?
I felt you like touching it.
They can be hard to get. So some of them can be difficult. Is it the examiner? Or, just not successfully striking the tendon? Or is it a problem with the patient? And then back here, the triceps. Nothing, huh? Let me try the other side.
So it would be really difficult with someone with a lot of adipose tissue.
Yep.
Okay.
Nothing. Sometimes I pre-screen, and I forgot to do that with this class. Some students can self-identify that they have very good reflexes. Is there anyone here who has really good reflexes? Okay.
I know my knees are good.
Yeah, my knees are good.
Yeah. All right, so let's see the bicep. That wasn't a little jump?
A little bit.
So you can just see if you can get it. Oh, yeah. About 4 inches up here. Is that a little bit?
I'm trying
You
not
didn't
to
feel
look.
it?
I feel it moving, but I'm trying not to look so I don't just.
I would say I was not successful with her upper extremities. So can you put on your shoes?
Of course.
And can you walk heel to toe towards the storage room?
Heel to toe.
Like in tandem. Turn around and watch me heel. This.
Oh, okay. I thought you meant like.
You already failed.
I feel like this is like a sobriety test.
That's right. That is correct.
That's where they got it from.
Yeah. All right. So come back on your toes. Now on your heels. Okay, now stand and hop on one foot.
Does it matter which one?
No. Hop on the other foot. Okay, now stand straight and tall. Now close your eyes. A little sway. You can see a little sway, which is normal. Now what I want you to do is put your finger to your nose and then to my finger. Again, 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 again. So the other one. Just
Think she
eye-hand
passes.
coordination. Then if you want to sit down, you don't have to get back on the bed, just there. So what I want you to do is alternate your hands. Faster and faster and faster. And now your fingers. And faster and faster and faster. Very good.
That's really hard.
So,
Feel confident about that one.
neuro check. Any questions or anything?
Would you do lymph nodes at that same point,
So,
or around the time when you're like looking at her swallowing and stuff?
So, right, it is the head to toe, and then you integrate the cranial nerves. And really, do you want to hop up on the bed?
Of course.
Can you?
Yep.
Yeah, so you start at the top, and really, the neuro check is right here, except when we work our way down to the reflexes. So this has to be done sitting, and then the walking. So you might do everything here, and then the cardiac and abdomen there, and the whole skin check, and the pulses throughout the body while they're reclining. And then have them get up before you're finished. So that could be the last thing. Or it could be the first thing if you want. But usually it's just easier to begin like this, because you'll begin to identify, are there any kind of problems sort of neurologically. And then I don't think there's a problem with your arms. I just couldn't get the reflexes. Okay, so that's it. You should be able to practice all the different